Maury Walker.
Maury Walker, you are a registered nurse.
Yes, sir. This question may be for Dr. Lipid again, but you know what? I know as a registered nurse that diet and exercise is the key to, maintaining a healthy, getting to a healthy lifestyle and maintaining. But when we were talking about the dangers of being an android shape, which is someone who carries the belly fat carries most of their fat in the belly, I just couldn't help but think, and we were seeing slides of the tissue, the fat cells in the tissue. I just was thinking about, and I know this is a lazy American typical thing to think, what about if we suck that out with liposuction, or freeze it, right?
Bill, why don't you throw that one to Dr. Oderod, who's
Oh, I'm sorry. Okay, let me get Dr. Oderod in here, please. Would you stand up? Did you get the question?
Yes.
I'll bet
yes.
you did. All right, tell us your full name.
Yes, I'm Gila Kaberi-Oderod.
And where are you based?
Yeah, I'm with Lacon Medical Group. It's my practice also. I work with a residency program.
And what is your specialty?
I'm an internist, but also I have specialty in nutrition and lipidology.
Okay, now we have the answer to the question.
Yes.
What is the question?
The question was liposuction, I think, removing the fat from the abdominal area, if it's going to help you out or not. The question is no. The answer is no. The reason is that the type of fat that is actually causing problem also depends on where it is. And we're talking about the fat that is mostly in the visceral area inside the abdomen. And just the liposuction by itself is not going to help, because actually compared to the type of fat that you have, that superficial fat is less benign on the other, compared to the other ones. The other issue about that is, in order to have a change in the effect of the fat, you have to have a negative energy balance. And with the liposuction, you can't get that negative energy balance. So it is very important to look at it this way, that decreased intake and increased exercise that gives you that negative energy balance is really incorporated to your treatment.
Okay, thank you so much. We're going to go to a map right after we see the last section of Ellie's life story. Here, Ellie, you'll remember Ellie Kosmark had open heart surgery, I think she said 4 months ago, with Dr. Stahl. We're going to go back and see the last, I think, 3 minutes of that videotape, and then we're going to come back and look at a map of the United States, a map of obesity that shows you where the issue is most pronounced, and I think it's going to surprise you. But let's go to the Ellie video, part 3.
I am doing my cool down, my cardiac rehab. I'm on the treadmill, and I'm cooling down. I get tired still, and especially after exercising, you still get a little. It's been 2 months. I'm 2 months out of my surgery, so I still feel a little bit tired, but I feel good. Also,
okay, sure.
So, but my blood sugars have improved a lot. Since we did all of the, the changes with the.
Pulling out your pump so you can take a
Sure.
look here.
This is my new insulin pump. My last one was
Pretty
purple.
pink.
This one was pink.
Insulin pump.
And this helps me. I put in, with the help of Sharon, who is a diabetes educator and also my pump trainer, and I put in how much food I eat. I go in and enter the amount of carbohydrates that I eat, and everything is programmed into the pump, and it tells me how much insulin I need to take for the food that I eat. And it gives me my insulin all day long, and then I don't have to take
Your basal is delivered little by little.
Yeah, my
and
basal,
your bolus
right.
is with your meals.
With my meals.
Or if you're running high.
Mm-hmm.
You've been trying to lose the weight that I gather you
Right.
gained over the years, right?
Right.
And you're watching your diet, you're trying
Yeah.
to eat healthier,
Turkey
less
burgers,
turkey
veggie
burgers,
burgers.
more, more non-fattening type of foods,
Right.
more poultry without the skin, and
Right.
less red meat fats, if any.
Right.
And no fried foods if you
No
can
fried
avoid it. And
foods.
you also watch your calories, because that's
Yes.
what puts the pounds on, right?
Right.
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 And then the exercise is very important, and I hear you enjoyed rehab?
they're teaching me. They know, they watch what your limits are. They tell you if you have to slow down a little bit. They tell you when you could pick it up a little bit.
Right.
And, you know, they make you move.
Well, I'm proud of you because a lot
thank
of
you.
patients don't always do the right thing after we've solved maybe the problem, the immediate problem with the heart, but it's important that the patients take charge of their own lives.
Right.
Try to lose the weight they've gained over the years, which gets harder and harder as we get
Sure,
older.
as we get older.
But we need to watch our calories as well as fat and sometimes sugar content, depending on your health issues. And the exercise is so important and makes you feel good too, right?
Yeah,
it gives you
does.
a better mental
It gives
attitude,
you a lot more energy,
right?
yeah.
Which is hard to do in the beginning, but I think the structured rehab that most patients go through after open heart surgery is so important to not only recovering from the open heart surgery, but try to get on a healthy lifestyle down the road and keep the
Right.
weight down. So I'm very proud of you. You've done everything.
you. I'm trying.
You're an ideal patient,
Thanks.
okay? And,
I'm good.
You're helping
I'm
yourself.
trying.
And
Yeah.
you're helping yourself.
I'm trying.
Right.
It's been 4 months since my surgery. I'm feeling better every day. I feel a little bit better. I finished up my cardiac rehab on Friday. It was my last day. I did 12 weeks of that. I'm riding my bike that I wanted to ride. I just started to ride that, but I am exercising at home. I've made a lot of lifestyle changes with my food and you know, things of that nature, making sure that I do exercise. I am looking forward to having a nice, long, happy, healthy life. I've lost about 11 pounds. I'm working on that. I have more to lose, and I know that, but I also know that it's going to take a little time to get the rest of the weight off, but I'm working on it.
Yeah, a wonderful story. And if you see your screen right now, here is Ellie with the doctor, Dr. Russell Stahl. Ellie, what do you want to say to Dr. Stahl?
Thank you. Thank you. I really feel like he saved my life. He came to me in a bad time and told me that he would make me better, and he guaranteed me about 50 good years. And
Wow.
yeah.
That's more than I usually get.
Yeah.
Did he put that in
I
writing?
wanted to get you on TV.
He promised me all kinds of things, so I would go on TV.
And what, Dr.
Well,
Stahl?
let me respond for a second. First of all, you know, I don't do this alone. Okay, a lot of these people here are doctors and nurses that work with me every day, and we have a wonderful team at CMC, and they did the heavy lifting. You saw in the video Sharon, one of our diabetic teaching nurses. You saw Dr. Kevin Olson there, her cardiologist, who made the diagnosis. In the audience is Marcia and Javon, who've worked with Ellie. That's part of her wellness team that's trying to nurture her along. It's not just me, right? There's a large group of people who are helping.
Understood. Well, Ellie, you've been such a wonderful model for us tonight. Thank you so much for doing it.
Thank you.
All right, why don't you come and watch your step.
Thank you, Doctor.
All right. We're back in the audience. Your name?
Randolph.
Give us a little more than that, Randolph.
Randolph Ruffin.
And where are you from?
I am from Scranton. I am a nurse at CMC.
You're a nurse at CMC
Yes.
in Scranton. What kind of a nurse are you?
I work in the cardiothoracic intensive care unit, so we get Dr. Stahl's patients right out of the operating room.
Have you met Ellie?
Not that I remember. They kind of look different when you see them outside of the hospital.
All right, what did you want to say?
I have a question for the panel. My question is, when you see a patient and they've told you, I've made the diet modifications, I've increased my exercise, but I'm just not losing the weight, how do you respond to that?
Donna, it looks like it's going to you.
I know, it's turf. Basically, I would take and walk through what they're doing, because your diet modifications to you may be something different to me. Your exercise program for you may be something different for me. So I would review that with you, because maybe that's not what you need. You know, maybe you need some tweaking in that or alterations in that to get you there. Or maybe there is a metabolic component to it. Maybe there's something more. But a lot of people tell me who have problems, well, I exercise a lot. Their definition of exercising a lot and my definition will vary a lot. So it would come down to specifically looking at what you're doing. And I'd ask you to spell that out, what your exercise program is, what your nutrition program is. And then I'll make the determinant.
Okay, we have about 5 minutes left in the show. I want to get Janet, Dr. Voice, I want to get you back in the program. Let's do it, if we may, around the map. I'm going to put the map up on the screen. I hope you can see it from where you are. This is...
We know that map.
You know that map. Take a look at this. In the color codes, you may not be able to